Before the procedure, remember the acronym CPAC. C. Check. Check records, medication record, or obtain an order if necessary. Medications the client is receiving because certain medications may hamper movement or alertness of the client. Determine the assistive devices that will be required. Determine the hindrances to movement such as an IV or an indwelling urinary catheter. P. Procure. Obtain signed informed consent if needed. Obtain assistance required from other healthcare personnel if needed. A. Aseptic technique. Wash hands and don procedure gloves if needed. C. Collect. Gather supplies and equipment and make sure equipment is functioning well before approaching client. When approaching the client, remember the acronym CARES. C. Connect. Introduce self and instructor to client. Identify client, read wristband and ask client to state his name. A. Assess. Make relevant assessments, take vital signs to ensure that the client still requires the procedure, can tolerate it, and that there are no contraindications. R. Rationalize. Explain procedure to the client, including what he will feel and is expected to do. E. Establish privacy. Provide privacy. Ask visitors to step out and drapes appropriately. S. Support. Use good body mechanics, positions bed accordingly.
Good day, ma'am. I am Kennedy Kipon and I will be your student nurse for today. Please state your name first. So, ma'am, I will be in charge with your body positioning and body mechanics. Can you please cooperate with this procedure, ma'am? Okay, thank you.
During the procedure, remember the acronym CARE. C. Control infection. Wash hands before touching the client. A. Aesthetic. Maintain correct body mechanics. Perform procedure with acceptable style and art. R. Risk protection or safety. Explain rationale of procedure to the client. Provide client safety. Keep side rail up on far side of bed. Continue to observe the client while performing the procedural steps. E. Efficiency. Perform procedure in an acceptable period. Demonstrate coordination in handling equipment. Follow correct procedural steps. Turning a client to the lateral position in bed. Step 1. Position yourself and the client appropriately before performing the move. Other individuals stand on the opposite side of the bed. Adjust the head of the bed to a flat position or as low as the client can tolerate. Raise the bed to a height appropriate to personal safety. Lock the wheels on the bed. Move the client closer to the side of the bed opposite the side the client will face when turned. While standing on the side of the nearest the client, place the client's near arm across the chest. Abduct the client's afar shoulder slightly from the side of the body and externally rotate the shoulder. Place the client's near ankle and foot across the far ankle and foot. The person on the side of the bed toward which the client will turn should be positioned directly in line with the client's waistline and as close to the bed as possible. Step 2. Roll the client to the lateral position. The second person or persons Standing on the opposite side of the bed helps roll the client from the other side. Place one hand on the client's far hip and the other hand on the client's far shoulder. Position the client on his or her side with arms and legs positioned and supported properly. Turning a client to prone position in bed. To turn the client to the prone position, follow the steps 1 to 5 with exceptions of the arms.
So ma'am, I will change you from this position to prone position. Is it okay with you? Okay.
Instead of abducting the far arm, keep the client's arm alongside the body for the client to roll over. Roll the client completely onto the abdomen. Never pull the client across the bed while the client is in prone position. After the procedure, remember the acronym CARED. C. Check. Check client's response to the procedure. Check if client is comfortable, safe position with call light within reach, returns bed to low position and raises side rail.
Are you comfortable with this position, ma'am? Okay.
A. Aftercare. Remove extra equipment or materials used during the procedure. R. Rewash. Wash hands again before leaving the room. E. Evaluate. Evaluate client's general status and response to the procedure. Check the skin integrity of the pressure areas from the previous position. Related findings to previous assessment data if available. Conduct follow-up assessment for a previous and/or new skin breakdown areas. Conduct any follow-up indicated during your care of the client. Ensure that the client is comfortable and in a good position while on bed. Determine that all required safety precautions are in place. D. Document. Documents that procedure was done and all relevant information.